Yeah, so because of coronavirus, we don't have interviews for residency this year in person. So it's all on Zoom. So a lot of the programs all over the country are like making videos to like sort of sell their program. So
you're witnessing an interview right now.
Awesome.
My name is Kenneth Moore. I'm a 6-year resident here in Memphis, Tennessee. Originally from a small town called Moweaqua, Illinois. I went to medical school at Indiana University in Indianapolis, and so during residency I developed an interest in cerebrovascular and endovascular neurosurgery, and I'll be completing a fellowship here in Memphis, Tennessee, half enfolded as a PGY7 and staying on as a PGY8 to complete the fellowship.
Luckily, Kenny's a great guy. I've been blessed to have him as a co-resident. Hi, I'm Vince Wynn, PGY6. I'm from San Jose, California. Went to medical school at Temple in the Northeast in Philadelphia, and then came down here for an interview. Really liked it. Came back for a second look, and it was history after that.
My name's David Wallace, PGY1. So I grew up in Nashville, went to college at the University of Alabama. I took a year off after college to go travel, work on my Spanish. Fell in love with Memphis, got to know the residency program really well during my time in med school. Kind of fell in love early and knew I wanted to stay here.
My name is Sean Hemel. I'm a first-year resident here in Memphis. I'm from Madison, Mississippi. I ended up in Memphis because I love the resident mentality here and the opportunities that come with being a resident here. You get early opportunities to operate, and it's a really great place. Obviously, it's pretty beautiful. We have a beautiful sunset here out on the river. I just love it here.
My name is Amal Lesha. I'm a PGY1. I'm originally from Albania, which is a small country in Southeast Europe. I moved to Boston when I was 19. I started college there, UMass Boston. I went to medical school at Tufts Medical, which is in Boston. And then I heard about Memphis and the great neurosurgery program, and I decided to check it out as a Sabbath. I came here. I love the place. I love the weather. I'm a guy that prefers warm weather.
My name is Deke Blum. I'm a PGY2 here in Memphis. So there's 4 people total in my class. It's kind of, I think you have a special relationship because you kind of all enter this training, at the same time, and it's a huge undertaking, and it's something that you've never done before, and it kind of, I think, forms a bond that is special. And I think that we certainly have that here.
Hey, I'm Rachel Stein. I'm one of the PGY2s here at Memphis. Memphis has been good. So I moved here during COVID times, so it's been a little weird with not having everything open, but so far I've really enjoyed it.
My name's Barrett Schwartz. I'm a second-year resident at UT. Originally from Indianapolis. My fellow PGY2s, we're kind of a eclectic bunch, come from very different backgrounds, but for some reason it works. We get along super well.
Hey, I'm Mustafa Motiwala. I'm a second-year neurosurgery resident at the University of Tennessee Semmes-Murphey Clinic. I'm actually from Memphis. In terms of talking about my co-residents, the greatest strength that we all have and we all share is a willingness to work together. More than anything, I think, we have each other's backs. We all tend to get along, and it's great to have them.
Hey, my name is Kara Parikh. I'm a PGY3 here at Memphis. I was born and raised in Chicago, Illinois. Did my medical school in New Orleans, and now I'm here in Memphis. My co-resident is Jock Willard. So if the residency is a siblinghood, your co-resident is your twin. Jock is definitely kind of that center point for me, and I'm glad I matched with him.
I'm Jock Willard, and I'm a third year. Yeah, I'm from Memphis originally. Went to high school here. Parents still live here. I stuck around Memphis because not only did I love the city, it's a great place to live, but it was a fantastic residency program. We're a very cohesive group. I'm very close to my co-resident for my own PGY year. Developed both a professional and personal relationships, a lot of good friendships, and so I would definitely say there's a lot of camaraderie in this program.
Hi, my name is Mallory Dacus. I am a PGY4 here at University of Tennessee. I am from Memphis originally and ended up coming back here for my residency because I was very lucky to have a high caliber program in my own backyard.
Garrett Venable, PGY5 here at University of Tennessee. I knew that I wanted to stay here Mangum really wanted to be here also, so we sort of both kind of as a team, tried to position ourselves to come here. We're very like-minded. He's a very hard worker. I couldn't ask for a better co-resident.
Okay, my name is Will Mangum. I'm a PGY5 resident here at UT Semmes-Murphey. So I went to college at the Naval Academy in Maryland and started medical school after getting out of the Marines. I was in the Marines for about 5.5 years after college. I went to Brown in Providence, Rhode Island for medical school and finished that up in 2016. Definitely wanted to come back to the Southeast, originally from Alabama. So as we were looking at programs in the Southeast, UT Memphis really stood out.
My name is Doug Taylor. I'm a PGY7. I am from Memphis, Tennessee. Born and raised. I went to medical school here in Memphis. Got to know the guys really well, and I knew that they produced what seemed to me very competent neurosurgeons. So, of all the places that I went and looked at, I felt that I fit in the best here, and I knew I could get great training.
My name is Jafar Basma. I'm a PGY7 here in Memphis. I am from Lebanon. That's where I went to medical school, and then I did the research on Dora, and I visited this place and I loved it, and that's how I met you. If you want to become a good surgeon, who is technically capable and who can make good decisions, take care of the patients, this is the good place to be, and with the best of hard work in it. At the same time, you also will have a good time. There's a lot of good people here, a lot of good friends here united.
Comparing Memphis to other programs, I think that coming in as a medical student and even as a brand new intern, you don't appreciate some of the diversity that we get just in the fact that we cover so many hospitals. We have a wonderful pediatric rotation and get a ton of brain tumors there. We have unbelievable spine experience at the surgery center here at the Baptist, and of course, the trauma experience is really unrivaled. Those were things that I think I kind of heard people say that didn't really appreciate or understand at the same time when I was first coming into residency that I do now. I think we're a very well-rounded program in terms of the types of cases that we see and the experience, the operative experience that we gain. Yet our case volume is remarkable. So you get the benefits of seeing all these different neurosurgical pathologies and getting all the case experience. You don't have to live in a super large, inconvenient, expensive city that it takes you 45 minutes to get to work in.
It is a wide breadth of pathology. You really see everything here and start feeling comfortable with seeing a lot of really sick patients. And honestly, it's just a fun place to be.
You see all comers. You see patients of all types, all colors, all backgrounds, and it's just massive volume. It's one of the benefits of being at Semmes-Murphey and UT is that we have a huge catchment area for one, but really we're the only shop in town. There's not much competition as opposed to some other big cities where there's multiple shops in town. So we get our pick of the cases. We get the best cases in town. I think there's a lot of flexibility in the program that you may not realize early on. The England experience is huge, something that I didn't really appreciate when I was first applying, but I think it's a big jewel of our program. And then really just the flexibility that you can do anything that you want. I didn't have a huge interest in endovascular, which is one of our strengths, but something that I've picked up recently, and I'm actually doing a fellowship on. So I think from here you can really do anything that you want.
Well, I think the difficult thing at this stage of my career is that I haven't found something that I'm not interested in yet. Everything I do, I really enjoy more and more. So a great thing about the program here is that we have a lot of strengths in various different subspecialties and departments. So whether it's vascular or pediatrics or spine, whatever you're into, there's probably a faculty member or the facilities and resources you need to thrive and do well in that specialty.
We have a great relationship with our faculty. Personally, I'm actually in a band with a couple of the attendees. It's a big band. We have, well, at our height, we had 12 members. Basically kind of like old school, like Memphis music, soul and stuff. It's great. We played at the AANS twice now, in LA and in San Diego.
One of the big points for me when I was kind of compiling my final rank list was I wanted a program that sort of had a good breadth, that I felt like at the end of 7 years I was going to be a competent general practice neurosurgeon, but wouldn't hinder me from kind of pursuing any fellowship or subspecialty that I wanted.
We really get a unique opportunity as first years to really get involved in the operating room very early, which was one of the things that drew me to this program.
See, that's our goal. Operate early, operate often. You need repetition to master any skill. And neurosurgery is a skill that you learn in the operating room. There's a lot to learn. That's why it's a 7-year residency. So the more repetition you can get, the better.
I mean, we truly get a great experience with early autonomy. I think that's probably one thing probably a lot of people are going to say. But the thing about Memphis is, if you want to do something, you can. If whatever your interests are, whether it's vascular, spine, or functional, or peds, no one's gonna hold you back. If you want to do research, you can do research. But so if you have a lot of initiative, you can certainly do anything you want.
The staff really gives a lot of leeway to the residents here, a lot of freedom, but that comes with a lot of responsibility too, and you can tell the residents here are mature about that and handle that well. Having selfless team players is such a huge attribute and something that this residency in particular values strongly.
The culture here was something that really fit my personality. We have a great close relationship with our faculty as our mentors. Another thing that's very important professionally, especially surgically, is autonomy. And I felt like the balance when I was looking at different programs was struck really well in Memphis. Another key factor I think that is absolutely essential in residency training is mentorship. And mentorship, to be really effective, honestly, I think has to be organic. Every step of the way, there's always someone that's looking out for you to mentor you.
So when I was looking for a residency program, I think I knew first and foremost that being a good surgeon was my priority, as opposed to being a basic science researcher or something like that. And I think this program is one of the ones that's, I think, uniquely suited to producing a good technical surgeon. UT Memphis really stood out in terms of a solid clinical experience. We don't do a dedicated research year here, so it's just 7 straight years of neurosurgery, and I really liked that.
Well, I wasn't expecting that we're going to be doing a lot of research here in Memphis, but throughout the years this has been kind of surprising twist in residency. There's a lot of opportunities which I discovered that you can do. There's the lab, there's the database that you can pull up in spine and cranial, there's the peds part. So that was well beyond my expectations.
The top 2 things I was looking for: surgical experience, volume, hands-on, autonomy, have all played out beautifully. I've done more cases than I can ask for. And then also built great relationships with some people here. When treated for anything.
I think the 2 biggest strengths that that don't probably show up on paper necessarily would be the resident camaraderie and just the strength of the very clinical experience. Having a group of residents that are going through the same thing as you, where you could be very adversarial and very competition kind of based, or in fact very just supportive and collegial and very much an all for one and one for all type mentality.
I'll say one thing, my co-residents certainly have made it a lot easier. I know I was supposed to be on call his first day of life. He was born at, it's like 1 in the morning, and you actually took my call his first day of life. So, a lot of support from your co-residents to get people through family situations.
So we can all meet Wyatt.
Yeah. Ultimately, this is about learning to be a good, safe neurosurgeon that can treat patients well, practice safely, and take care of your family. And I think this is a place that really does that well. I don't think any doors are closed for you coming here for residency.
Well, first of all, I just want to say that I'm ready to get out there. Now, from a mental standpoint, but also like very prepared to get out there in the real world.
But on many levels, the things that I saw here that really stood out to me were the relationships that the residents have with one another, as well as with the faculty, and how well everybody gets along. And that's really important to me. 7 years is a long time. It's in the prime of our lives in our 20s and 30s. So being able to get a very high caliber operative experience, as well as with lots of research opportunities in a setting where I can still enjoy my colleagues and live in a city where things are affordable enough to have a good time in my select moments of downtime, that's really important to me.
I think we get a little bit of it all, actually a lot of it all. I think that no matter what career, I think that's the great thing about training here, is that no matter what path you want to take, the opportunity is here and the cases are here and the training is here to go do that and be successful.
Memphis is very unique in that our attendings are all Semmes-Murphey physicians. They are a private practice group who's affiliated with UT, so we have a little bit of the academic world and the private practice world together. So we get a little insight into how the two different worlds are similar, how they're different, and we can learn the positives from both.
I think you get the best of both worlds. You get the bit of academic flair that we all want going to neurosurgery, to have that experience. But you also get the real world private practice experience. You get a little bit of everything coming out here.
I think it's very important that at some point in your career as a neurosurgeon, you figure out how the actual business of medicine and neurosurgery in particular work. And I think the attendings here, in addition to getting us involved in academic pursuits and just training us on being neurosurgeons, also give us a very good window into some of the various aspects of running a private practice, such as billing, practice structure, clinic structure, patient selection, all those sorts of things that are some of the kind of what we might call soft details that you really have to have an appreciation for when you're making the transition from being a resident to being a physician in your own practice.
You really see the two sides merge together, and I think you can make a choice for yourself what works best and what you want for your career.
If you had to describe our residency program in a single word or a quick phrase, how would you describe it?
It's hard work, but it pays off.
Teamwork.
Work hard and have a good time.
One word, operate. Yes, operate. You operate a lot, all the time.
I would say strong. I think strong is the right word for many reasons, both surgical skills, clinical, academic. It's a strong program.
If I had to pick one word to describe our residency program, it would probably be family. We really are a family unit.
Say probably the first one would be collegial.
Yeah, it's probably honestly from that Three Musketeers, all for one for all, is probably the easiest way to say that. So,
Single word would be tough. Short phrase. 7 years of hard work, but with people you enjoy working with.
That's it. I feel like we work harder than anybody else I've talked to. I had friends on the trail. I had friends from med school. They talk about their residency, and it just doesn't seem like they might not have the same rigor that we do, but I feel like we earn what we get, and we are well trained because of it.
How would you describe your relationship with your co-residents?
I just connected with everybody here. I thought everybody was so easy to get along with, and they all worked hard, but they all, knew how to just kind of take a step back and enjoy their time here and have fun together. It's not like they all went their separate ways at the end of the day. It's like, the night was just an extension of the fun that they had during the day, and that's just continued here. I think we do a really good job of bringing in people that kind of fit the mold and get along with everybody.
It's really good learning atmosphere, and feel like you can go to anyone for advice or help and not feel critiqued or criticized.
You know, we support each other. There's no malignancy. You know, the seniors have the juniors' backs, and you learn so much from your co-residents. So that was like the number one for me.
Operating camaraderie, I say the two biggest things about the program. We work really hard, you guys stick together, and I think we do that pretty well.
What's great about this program is that it's very heavy clinical, so every day you're busy, you're operating, you're taking care of patients, and at the same time the environment between the residents and the attendings is very good. Everyone is approachable, they get along together, they're friends, at work and outside.
If I had to pick one word to describe our residency program, it would probably be family. We really are a family unit. It's a group of people that you can trust, you can count on, you can rely on. When we're not in the hospital, we're always trying to meet up, do something, and be around each other more because we're just we're family. We are each other's people.